Hello there, you've joined in a conversation on COVID-19. I'm Sneha Mordani. Let's get started. Today is an important day because India has started the vaccination drive for senior citizens above the age of 60 and those above the age of 45 with underlying healthcare conditions. In fact, just 3 hours ago, the registrations opened up, and what we are learning from across the country is that, as expected, the URL is giving problems. The OTP is not getting generated once you enter your mobile number, and the system is in fact very slow. That is what many people who are trying to log on are reporting. The government says we expected this, and it is for this reason walk-in registrations this time around and also walk-in vaccinations have been allowed. So unlike the last time around where you couldn't really walk into a vaccination site and ask for a shot against COVID-19, it's different now. You go to a vaccination site, show your proof of identity that you're above the age of 60, or if you are above the age of 45, then produce your medical certificate and get the shot against COVID-19. But the government says the preferred method continues to be registration, because then it is an appointment-based system, and that makes things simpler and quicker even for the beneficiary. How can you then register? There is no new COVID app. In fact, the software that exists right now is only being used by the administrators. What you and I can do if we have to register, that is if we are beneficiaries, then we can log on to cowin.gov.in, which is cowin.gov.in, and then do the registrations there. That's the URL. You'll have to use your smartphone for it. There is no other way. The browser is the smartphone. Apart from that, if you have downloaded the Arogya Setu app, there will be a new tab in which there will be a separate place for vaccinations, and that's how you can go about registering. So what are the choices that you have? No choice when it comes to the vaccine. Whichever site you go to, you'll have to take the vaccine that site is offering. Yes, you can choose a site which is of convenience in the sense it's closer to you, and you can also choose whether you want to pay for it by going to a private entity, a private vaccination site, or whether you want to go to a government center. That choice is up to you. That's your decision, but no choices when it comes to the vaccine per se. The government says both vaccines are safe and both will offer protection. That's the message loud and clear, even from the Prime Minister, who at around 7 this morning, even before that actually, went over to Delhi's All India Institute of Medical Sciences. No VVIP route was laid. He went there, got his shot of Covaxin, and put out a tweet which obviously has sent out a lot of reactions, in the world of Twitter. The people of the country, as soon as they got to know, many have said this is the best decision ever from the point of view of addressing the problem of vaccine hesitancy. Also sending out a message that this is indigenous vaccine, India's indigenous vaccine, and that the topmost in the government are backing it. The Prime Minister has taken the dose today. 28 days from now, he'll be getting the second dose of the vaccine, which of course completes his entire medical cycle of the vaccine, and after 14 days from the second dose will antibodies start to develop against COVID-19. That's how it usually works when it comes to vaccines, specifically in the case of Covishield and Covaxin, the two vaccines being used in the country against COVID-19. So Arogya Setu and cowin.gov.in is what you should look at. Let's get you a quick overview of the situation as far as the COVID-19 situation in the country is concerned. Once again, India has reported more than 15,000 new cases of COVID. Half a month ago, we were reporting less than 1,000. So there is a bit of a concern, is what the government is saying. States that are driving up the numbers are Maharashtra, for example, which for the 5th day in a row now has reported more than 8,000 cases of COVID-19. Mumbai City is reporting alone 1,051 cases. It reported yesterday. So that upsurge essentially continues. That's worrisome. But the good news in all of this, the target is that 27 crore people, the vulnerable categories that the government has identified, should be inoculated if all goes well, if the vaccination pace picks up pace. Then by July is what the target of the government essentially is. But at the current rate, we are very slow. We should be inoculating about 13 lakh people a day. What we're doing is about less than 3 lakh people, sometimes a little more, mostly around 3 lakh people a day At this rate, we certainly will be falling short of the target of 30 crore people. Also, what's clear is that at a private setting, you have to pay a little for these vaccines. It's about 150 rupees a dose, 100 for administering the vaccine. So it's 250 a dose. For 2 doses, you have to shell out 500 rupees. Having said that, this is the price you're paying for getting some amount of protection against an infection which has mutated also in the country. The government says right now the current understanding is that the vaccine is offering some amount of protection even against the mutant variants, is what the government has indicated. All in all, a good situation where the government has started to look at the priority group, getting them inoculated also at private hospitals which have been empaneled under the Ayushman Bharat or the PMJ program. The details are there, which hospital to go to. You can log on and check it out and see which is the hospital that you want to choose to get your shot against COVID-19. So these are the private hospitals which are empaneled. In general, private hospitals which are currently not under the Ayushman Bharat program, you cannot get a shot. So you can't walk into any private hospital and get the shot. You have to check from the website which are the hospitals. And also, it's important to note that those states like West Bengal, Telangana, for example, who do not have the Ayushman Bharat program, the state government is deciding which private hospitals to go to get the shot. But all of that is being monitored by the central government. Thank you for joining in.